Ladies and gentlemen, welcome to the Muscle Intelligence Podcast. I'm your host, Ben Pakulski. Today we are doing a live recorded podcast. I actually traveled to see this gentleman in Ontario, Canada. Dr. Stuart McGill joins me today. If you don't know Dr. Stu, he is the go-to expert for high performers who experience back pain. He is the number one authority in the world when it comes to back pain, when it comes to back research. Dr. Stu McGill is the guy. On top of that, he's truly an exceptional human and a gentleman. He's a distinguished professor emeritus from the University of Waterloo, where he was a professor for over 30 years. His laboratory experimented with research and investigated issues from mechanistic back pain, ultimately how to rehab back pain, and ultimately enhance injury resilience and performance. He's written books. He is the guy that governments reach out to when it comes to understanding the implications of back pain. Companies reach out to when it comes to doing research. In this interview, we talk about the mechanics of hypertrophy when it comes to back function. We talk about mindset and pain management and the anatomy of elite athletes and how that may be different from yours. The different pain patterns specific sports tend to exude, and the requirement for stability versus flexibility of the spine. This is a really interesting kind of divergence from the typical thought process. Most people think it's a very specific thing. Dr. Stu says it's something different. The world of strong athletes and major leaps in becoming a world-class performer, and ultimately how to create a truly resilient back. I really enjoyed this conversation with Dr. Stu. Feel truly grateful to be able to sit with him in his home and dive into his life's work, really. Today's podcast is brought to you by our friends over at Bioptimizers. Our favorite product, Mag Breakthrough, is still available to you, the muscle intelligence community, at 10%. This is a product that, if you're not already using it, get it. It's always a great addition to any repertoire. Will help so many different issues in the body. There's a countless number of benefits to magnesium. And the reason I choose Mag Breakthrough above all is it actually has 7 different chelates of magnesium, all of which have a different potential implication in the body. So you're getting a full spectrum to allow you to relax, unwind, turn off your active brain after a long and stressful day, certainly after a long and stressful workout, so you can wake up feeling rested, vibrant, and alert. I take a few capsules before bed to help with my recovery and ultimately wake up feeling like a champ and ready to go. You know, I train first thing in the morning, so what I do right before bed is incredibly important to me. And every time I take Mag Breakthrough before bed, I wake up feeling better. I just feel like I don't need the coffee. I don't need the stimulants or pre-workouts. My body just feels to have slept and recovered a little more effectively. This is truly a fantastic product that, in my opinion, blows all the other magnesium products out of the water. And Bioptimizers is just a reputable company. I know the owners quite well. I know the amount of time, energy, and sacrifice they put into research, and I'm a big fan of their products and their company. So thanks to Bioptimizers, thanks to Matt Gallant and Wade Lightheart, both previous guests on the show. Guys who not only are entrepreneurs, but they walk the walk. These guys train every day. To be honest, they're pushing the envelope in many different ways, each of them kind of in their own way. So head over to magbreakthrough.com/muscle. Use the code muscle10 to get hooked up with 10% off. Support our podcast sponsors because they support this podcast, and we love to support you with credible, no cost to consumer information. Ladies and gents, enjoy the podcast with Dr. Stu McGill. Is there something the audience can take away and say, hey, this is what we should be looking at? Or is it the type of thing where we just have to go to a professional to get assessed? That's what I'd kind of like to end. It's like,
again, I'm fairly purposeful like you.
I can tell.
If there was a better way, I'd be on it. But there's no medical professional whose primary job and skill set it is to assess back pain. So they stay at this level of non-specific back pain.
Yeah.
Who has non-specific knee pain or non-specific head pain? So you can treat a non-specific entity, and then it's just pure luck whether or not the intervention is matched and will help or will hurt. So I wrote Back Mechanic to guide the members of the lay public to do a self-assessment. And believe it or not, many of them with their coached assessment will have a better idea of what the specific pain triggers are. So it goes through a bit of a questionnaire. What makes your back pain worse? What makes it better? Oh, gardening makes it worse. Go for a walk. It makes it feel better. Okay, we've subcategorized it now. But the next person comes in and says, when I sit down, I get back pain relief. And yet when I go for a walk, it makes it worse.
Mm-hmm.
So, I had to write that book, Back Mechanic, to guide the lay public for that reason. When I was at the university, I got to follow up with every back pain person who came into the experimental research clinic. If they were told, you've tried everything, you've been to the chiro, the physio, you've been to the pain specialist, and you've been to the psychologist and had a surgical consult, the last thing left for you is surgery. If that was the category that you came in a 2-year follow-up, 95% of them had avoided surgery and were glad that they did. And I can stand by that statistic. So that's not every subcategory, but once you subcategorize pain, you have a much better chance of intervening with a matched intervention. And the intervention itself isn't easy, as you know. First of all, you have to wind down the pain sensitivity. Well, how do you do that? Well, if sitting happened to be it, we have to come up with a better way to sit, whether it's a modification in the chair, or it's an exposure thing where you only sit for 20 minutes, or whatever the case may be.
How do you subcategorize? So that's actually, I'm staring at your collection of spinal segments over there. I'm curious what the subcategories are. Is it, almost always related to kind of entrapment of the nerves? Is it, as you say, deterioration of the discs? What are the primary categories if you were to go through it that way?
Well, I don't know how many models are up there. They're made by a company called Dynamic Disc Designs, but every single one of those captures a real patient and their specific pain trigger. Almost always, but not all. Almost always a mechanical variable can make the pain better or worse, so you can understand the pain. A specific activity, a specific motion, a specific load, a specific stress concentration. If you can change the pain, you get to understand the specificity and the mechanism of that injury.
Right.
So there's many. It's very interesting. Well, I will also say, though, that there are many people who say, well, I have no pattern to my back pain except when it rains. I get a grumpy back. So there's a different situation where I'm the wrong person. But if they have mechanical back pain, we then go through a very systematic probing of their pain with an assessment that's provocative. We purposefully provoke their pain, understand the mechanics, then wind down their pain by showing them how to move in ways that doesn't create those stress concentrations. And then the final stage would be to rebuild their athleticism, knowing what biological adaptations we would have to create to make them robust. But having said all of that, in our conversation pre this, we were talking about sports and clustering, and different pain mechanisms and pathways cluster around specific sports, simply because of the exposure to mechanical stressors of the sport, the culture of the sport, etc. So if we were to take bodybuilding as an example versus powerlifting, that they'd be quite different common pathways to pain. A jiu-jitsu player would have a different pattern, once again, a professional baseball player, professional golfer. So there are variations, sometimes subtle, sometimes they're quite large between these different sports.
Yeah, so taking what you mentioned earlier, it seems like there's a dynamic nature between the requirement of stiffness and the requirement ultimately of the absence of stiffness, the requirement of fluidity to move through life. And there's a lot of components that lead people to be successful or unsuccessful in certain sports. And then sometimes what made someone successful in that sport sounds like maybe the very thing that leads them down the path of causing the repetitive nature of the injuries.
You will not be a successful gymnast if you don't have a whole spine, particularly in twist and extension. The facet joints, which are these two joints posterior to the discs of the spine, do you see how those are what we call a closed facet? They're orientated this way,
yep.
Whereas they have quite a variation. If you're a gymnast, they have to be open to allow you that mobility. I have closed facets. I have limited spine mobility. I will never be a gymnast. However, When you arch backwards with a closed facet, if you were to look at these facets, do you see how they glide beside one another?
Yeah.
Like this?
Yeah.
There's no stress, except if the capsule runs out of room. Whereas a gymnast, archetypical gymnastic spine, they're orientated this way. So when they arch back, one bone bends the next one. So if I said to you, what sport has the highest rate of spondylolisthesis, which is the fracture? So there is a typical spondylolisthesis.
Yep.
These bones here have fractured, and then the superior vertebra, the upper one, slips forward like that. If the facet joints are orientated this way, when that person arches back, you stress the pars bone, the very bone that's fractured there. When you bend forward, it reverses the stress. So these are called stress-strain reversals. If I wanted to work a hole in my shirt, I would create stress-strain reversals, and the fibers would delaminate. If I wanted to bend a stick back and forth, that's a stress-strain. And different materials and different biomaterials have fatigue lives. And again,
That makes sense.
ability to tolerate a fatigue life came from your parents in the beginning. And the very architecture of those facet joints that allowed you to be a gymnast means that when you arch back, you get even more stress on that bone. So you see why a spondylolisthesis or a spondylitic fracture has the highest incidence among fast bowlers in cricket, gymnasts, dancers, etc. They'd be quite rare in other sports.
So the very thing that allows you to rotate more to be a gymnast is also the thing that's going to cause these injuries.
We were talking earlier about, you look at record holders of different sports and their body is tuned to do that sport. So if we took a large man or woman, say an offensive tackle or someone like yourself, it wouldn't be really wise for you to do a large amount of sit-ups, as an example, because when you bend the thick spine back and forth, that stresses much bigger stress-strain reversals in the collagen fibers that form the discs. And yet, when you look at the man who holds the record for sequential sit-ups, you can understand now why he has a very slender spine. So you can bend the slender rod back and forth, and it does not create the cumulative stress-strain reversal. So that survives. But I wouldn't want to put that sit-up champion.
Simply due to the amount of force that spine can withstand, or like the moment arm, basically, right? The distance away from the center of the spine.
It's both of those, actually. Usually the size of the vertebra in cross-sectional area is linked to its strength. So they say, well, men can withstand more load than women. Is there a gender difference, or is it just a size difference, men being bigger, and it's basically the size difference? However, training now makes a big difference. You train heavy. The end plate of the vertebra is simply cartilage, and it bulges down into the cancellous bone, which actually act like leaf springs inside the vertebra. And you get tiny little fractures, and I can show you some of those if you wish. Now, that is a very minor micro compression fracture. Is that a good thing or is it a bad thing? Now the conversation shifts. When you look at bodybuilders, you train heavy 3 days a week, typically, day off in between, because you're traumatizing micro tears in the muscle, and it takes a day or so for them to recover so you can go again. Bone is different. If you create that micro fracture and then train again in 2 days, so you're now transitioning from a bodybuilding scenario into powerlifting or strongman, it takes longer than 2 days to gristle those microfractures. It takes about 5 days. So when you look at the very successful strong men and women and the power lifters, they might do very heavy squats 1 day a week, and you think they're undertrained. But they needed those 5 days to scaffold in the new ions of bone, calcium, magnesium. They're ions, they get sucked in chemically with their chemical charges, and it takes 5 days to really get a robust callus. So the next time they train heavy, they've already scaffolded and recovered those microfractures. So if they were to train on a bodybuilding schedule, the microfractures run ahead of the ability to scaffold in. So a radiologist would then look at that and say, that person there on the X-ray or bone density scan, they have sclerotic bone. They don't know whether it's been Pakulski coming in or some other person. If it's you coming in, that sclerotic bone is the adaptation. That's what you've adapted with years and years of training. So going back to the original discussion, even though your vertebrae are bigger, they're also a lot denser and stronger. Whereas someone else who hadn't had that training regimen, they might have the size of the bone, but not the bone density, or they might have accumulated micro trauma.
Yeah.
So that thing, that feature that's reported by the radiologist, as some poor patient comes in, I've got sclerotic bone, and I said, well, I'm damn glad you do, because you're training, you need it.
Yeah. One thing that came up as you're talking there is, it sounds like most, you could obviously correct me at any point if I'm incorrect, it sounds like most back injuries are repetitive strain, repetitive trauma. We do the same thing over and over and over again. Would that make an argument then for training with isometrics, as far as, like, if my goal is to accumulate strength in certain, length tension relationships with specific muscles?
Well, the answer is yes and no, but it needs a context.
Sure.
So if we were to take a jiu-jitsu master, folks are aware of what that is now because of MMA. If you take Gracie Jiu-Jitsu, for example, basically you require your spine to become a boa constrictor in athleticism. Some people, if you're a real Gracie practitioner, you don't put a lot of force into that. In fact, if you're going for a move that requires a lot of force in a highly deviated position, they will abandon the approach, set up the next submission attempt and try for that. So not require high strength. When you take a highly deviated spine and then put high strength through it, you've really created a stress concentration on the disc, and you'll get into trouble. So it's sport specific and it's technique specific. You cannot do isometrics if you're a Gracie Jiu-Jitsu elite practitioner, because the stress strain reversals on the collagen fibers will slowly delaminate them.
Even without movement?
Oh no, I'm talking about if they are practicing jiu-jitsu. And it wouldn't be a good preparation to do isometrics for a jiu-jitsu player. But my point in all of that is, don't use heavy load. You can use the motion, but not the load. I'm going to regress one level. In terms of disc injury, what causes cumulative injury is power, force times velocity. So a golfer, a jiu-jitsu practitioner has a lot of velocity, a lot of motion. Keep the force low. If you're a power lifter or a bodybuilder with high force, keep the motions low. So you can do spine isometrics and high volume, heavy repeated loading. But I know who I'm talking to here. When you are rowing, etc., you get the range of motion in the spinal muscles through clever technique, using the ball and socket joints to get the range of motion you need out of the muscles. But if you start doing that with the spine over and over again, there will be some people who are touched by the hand of God and they'll get away with it. Most of us will not. So limb muscles, of course, right? It's full dynamic, eccentric, concentrics. I've been lucky to measure, in fact, probably the only scientist in the world who's had the privilege of measuring, world's strongest man competitors, top bodybuilders, world record powerlifters. And how do they train? When I think of the man who has the strongest core and rotational spine that I've ever measured, do you think he does a lot of full range of motion side to side? No. He will stop, twist. In other words, his landmine exercise, where some people, they freeze their hips and take their spine through the range of motion. they're not the strongest. The strongest are the ones who can lock this in and then spin through their feet and through their head.
Right.
In other words, they are stopping motion. But then when you compete with them, if they were to take an arm drag or an underhook or Greco-Roman wrestling or judo moves, they lock this and power with
the hips. Yeah.
I don't care what athletics we're talking about. A good hip beats a spine any day of the week. And the great ones, when you measure them, are really hip dominant. The second best layers are spine centric. Hip power going into an isometric spine that produces ungodly performance.
That makes sense. You said measure. What are we measuring?
Tissue stress distributions through their spine, because injuries occur where the stress concentrations are the highest. So I'm measuring that. I'm measuring three-dimensional spine motion. I'm measuring through EMG muscle contraction levels. And then with the reconstruction of their skeleton 3D motions, I get to know force length relationships, force velocity relationships, etc. We, not always, because it's a very computational, intense exercise, but we will measure spine stability as well. Or we have done. I'm retired now, but that's where we left our career. One of the nice experiments that I did just before I left the university was watching spines move under fluoroscopy. So it was actually with whiplash people, but I'm going to give it a bodybuilding context. You will see victims of whiplash. They are really being accused by the medical system of faking it. It's been a year or two since I've had whiplash now, and the medics might say, or the insurance companies will say, oh, well, the injury is lasting longer than 3 months or 12 weeks, whatever the statute is. You must be a pain magnifier. You're a faker. Can you imagine how psychologically devastating that is when someone who truly has disabling pain and then someone says it's in their head? Mm-hmm. It's just a travesty. We took people, they had normal MRI images, but an MRI image is a static picture. It doesn't show you the mechanics of pain. And then we would take the person through the range of motion, watching their spine with real-time moving x-rays. So it creates a video. You see all the bones. And then they will move and then they can move a little bit further. At the time of that pain shot, the vertebrae move and rotate, and then clunk. You get an instability clunk like that.
Right.
And it's associated one-to-one with their pain. In other words, they're not faking. We now have a technology that shows the disruption of mechanics. And when the center of rotation leaves the joint with the clunk, the center of rotation at the instant of clunk will be down here.
Yep.
That shows aberrant mechanics and the instability. So now we take that into our discussion we had before. When I'm involved with athletes who are big, strong, and heavy, when they lose weight, all of a sudden their joints go painful. So I'm working with a current Mr. Olympia competitor at the moment. Another thing that we're measuring are the mechanics of muscle hypertrophy and what they do with joints. So if I can double the moment arm of the muscle through hypertrophy, I now create double the torque. Mm-hmm. Or for the same load, I half the load on the joint because the muscle spans the joint. So if I was to do an arm curl, the 5 pounds or 5 kilo or whatever it is in my hand is moved by this muscle that has 1/15 of the moment arm. I need 75 pounds of force in the bicep to lift 5 pounds here. Well, I could curl 50 pounds, walk in the park. 750 pounds in that muscle, but the architecture of the muscle now spans the joint. The joint is being compressed. 750 pounds for me to lift 50. Well, think of what's going on in the back. Someone's deadlifting 1,000. So you can pick up 100 kilo with half the load on your spine than I would, being half the mechanical advantage.
Right.
So muscle hypertrophy unloads the joints. But here we're playing a game of trade-offs. Some people will say, okay, well, I'll just grow my muscles now and unload my joints. Well, hold on. The trauma and the mileage you put on the joints to get the muscle bulk is an entirely different other side of the equation. But going back to, we have large men and women now, and really were relatively joint pain-free while they were training. Now, getting back to civilian life, they've lost the mass, and now their joints ache, and they say, what's going on? I was supposed to do this to become less painful and more healthy. You've decreased the mechanical advantage of the muscles. So the instability in the joints now, the ligaments are a bit lax, the discs have a few miles on them, they're a bit loose, but the muscle bulk and their mechanical advantage stiffened the joints very effectively. So then when they lose mass, now the micro movements are starting to appear uncontrolled. And it's the micro movements, usually in shear, that triggers the pain. Think of a knee now with an ACL deficiency. You do a drawer test to measure the shear. As these big jacks decrease their mechanical advantage, their ability to stiffen and control the micro movements decreases now. They start to ache. So I don't know if you can relate to that or not.
Talking my language. It's true. And it's absolutely true. And as you said, I was completely anticipating losing all this literal load on my skeletal system, on the muscular system. I was like, I'm going to feel so much better. And it's significantly worse. And I was saying to you, like, if I don't get to train 3 times a week, I feel terrible. Like, my body feels like it's like, I'm like waking up in the morning like the Tin Man. I'm like, I gotta move. But if I train, I feel like a newborn baby. I can run, I can jump, I can play. If I don't, I literally feel like my body's like contracting to hold itself together.
The first one is, once you start training, and as dedicated as you and your colleagues were, it's almost a little bit of a deal with the devil in that you're committed to maintain a little bit of it now, even after you're retired. Because of the mileage on the joints, you're going to need a little bit more help and assistance from the muscles.
Makes sense.
From the mechanical advantage and that 3-dimensional stiffness, enhancing joint integrity. The second part of it, though, is life follows stages in terms of our bodies. As you get mileage on a joint or literal damage to a joint, micro damage, it becomes unstable. It loses stiffness. That is the definition of instability. You push it and you get a little bit of a micro movement. Over time, though, you'll find, and I lifted far heavier than I ought to have when I was younger. And as I lost weight, I did become more micro movement unstable. But I'm 66 now. I've gone into the 3rd stage, which is stiffness. The bad news is I've become a bit stiffer. The good news is all my pain is gone. So my prediction for you is you will graduate to this 3rd stage. You're right now in a unstable phase. You will go right back into a stable phase once again as the joints get a bit grumpy. I'm going to suggest, don't do yoga and bending on your spine. Let it be. Your hips and knees are good. Use them. And I think you'll retire a much happier man.
I think it's possible to train to the level that I did without deteriorating your joints. Like if your mechanics were flawless.
I'm not qualified to talk about all of the other joints except the spine.
Yeah.
There is the very odd bodybuilder where I would say that's true.
Genetic anomalies.
Yeah. Oh, yeah. Well, you're freaks, so I hate to say it. Let me put it you were blessed by God. Yeah. Let's put it that way. But no, for the vast majority, you will have a few things to deal with your back. I don't know too many who've gotten away with it. I should just back up a little bit here, Ben. What we do in life are managed biological tipping points. So let's just take vitamin D. If you're vitamin D deficient, you're under the tipping point. So you're in ill health. If you vitamin D supplement, you enhance your health, but only up to the tipping point. Any more vitamin D in additional to that crosses the tipping point, it becomes a poison. So think of everything in life has this tipping point. All physical loading follows exactly the same tipping point, but there's magnitude, there's duration, there's repetition, there's rest, there's food, there's all of these variables that modulate where that tipping point is. Maybe you were really good and you engineered and controlled all of those variables to stay just on the anabolic side of the tipping point, and you've built great resilience. And I can name a few very strong men who've really done well. It's not the majority.
Yeah. Yeah, most people are doing it, just their only lever is the gas pedal, right? It's like, I'm just going to go harder. And that's wonderful at the time, but definitely it's the idea of the faster you go in the car, the more precise your steering has to be. And if you don't know how to, manage the steering wheel very effectively, inevitably you're going to hurt something. And I think everyone at a high level, I'm sure you could attest, has done something when you're, it's like live by the sword, die by the sword.
Even, that was a favorite saying of my father. Even, myself, I wish I could engineer a little bit better, and I still screw up.
The training was? Yeah.
Well, I still managed to hurt myself, and why did I do that? I knew better.
So what are some of the common mistakes people are making when it comes to their thought process around back pain? Because you hear all these sound bites getting thrown on social media, and I would briefly kind of mention that, but so there's, I don't even want to get into what I hear. I'm curious what you hear are the sound bites that are, misleading, misguiding, or inaccurate.
The problem with social media, it's a short sound bite without context. So my answer to your question is it's all misleading because none of it is relevant to the person. If we could establish the context, when a person comes here for a back pain consult, I'm here with them typically for at least 3 hours. Wow. I have to establish the context of their life, what their goals are, the mechanisms of their pain, all of the pressures that have caused them to fail in the past. All of these things matter. And then I have to establish what are the mechanics that make their pain better and worse. Now, once in 200 people, the mechanics don't make a difference. It's only 1 in 200, maybe even more rare than that. That person will have Lyme disease, or that person will have a cancerous tumor on their spine, or they have an aneurysm, or something really nasty, or maybe they have spina bifida that no one ever discovered before, and something's actually rubbing on a raw nerve root that should have been bridged with bone for protection. So if the mechanics during our testing here don't change the pain for better or worse, then I refer them back to someone else, and it's saved their lives in a few instances. They didn't know they had something, what we would call a red flag or sinister. But most of the time, we can find, with great precision actually, what the load threshold is that causes their pain, and then we give them a movement hack around it. So say simply bending forward and tying their shoe, it's the act of doing that to their spine over and over again that keeps that, if it was a disc bulge mechanism pressing on a nerve root, it keeps it raw and active. But if we show them, I'm going to sit up now like a weightlifter, but if I didn't, and they come in here and they keep their knees together, they slink, stressing and causing the pain. Their little toe is now going numb, and out they get out of the chair like that. It's an impossible mechanic, but no one has ever shown them how to move in a way that gives them confidence that they can navigate this pain. Spread your knees apart, get your feet underneath you, suck a little air, Now you've stabilized the disc bulge. It's not possible to recreate, lean forward through your hips and pull your hips through. Oh, doc, you're amazing. That took my pain away. Well, we call that spine hygiene. Simply an appropriate movement pattern to avoid the cause and allow it to settle down. Disc bulges, which I've shown you several examples of here, over time will gristle and stiffen. So, how many years do I have to move like this? Well, son, last night I watched the NHL game and I had 2 players in that game who were managing very successful open fissure disc bulges. They're playing in the NHL. It's just they know how to not sit slouched on the bench, but that they sit up, they can still be. And by the way, they don't tie their own skates. So tying their skates increases the risk of them having an acute attack during the game. If their trainer ties their skates, they can get through the NHL game without fear of a trigger. And some people laugh at this, but it's how we work so hard in understanding the precision of their trigger and giving them movement hacks to still compete at a very high level. So when a person off the street says, "Oh, you can't do that," and I say, "Well, you don't realize what the professional athletes dedicate themselves to doing."
Right.
So I don't know if that answers your question or not, but I've given you context now.
Yeah.
You might hear whatever on social media, but until you have that, if you could spend a day here and see. Now, I'm not saying we're successful with everybody, not by a long shot, but that's the professionalism of understanding and dealing with some specificity, that person's mechanism in their particular world, and you'll never capture that context in social media.
So talk to me about that then. So a professional athlete bends over to tie their skate. They'll sit up. They're fine. They tie their skate, but 30 minutes, 60 minutes, 2 hours later, the back goes. So how is it that preemptive event has loaded the gun to create the cascade that happens later? Is it something that they're causing a micro trauma, an inflammatory response, the muscles to tighten up, and just something they do later? Let's start that question. I'd love to answer that.
There's an open fissure disc bulge. So the player that I was referencing last night when we were watching the game, that is very precisely the mechanism that they have. As they bend forward, with enough time now, if they just bend forward and then squeeze it, it takes some time for that disc bulge to grow. Now, we can watch that disc bulge grow in an MRI machine. I've got a colleague who's a chief radiologist. He's got an open fissure in his neck. There is no disc bulge, but when he does this for about 15 minutes, the bulge keeps growing and growing. And then all of a sudden, he's got the effect that is debilitating. And then through mechanics, we can work that disc bulge back in another 15 minutes and the symptom's gone. But it took 15 minutes for that disc bulge to keep growing, and if all of a sudden it touches the nerve and they have a full-blown, enormously inflammatory, debilitating acute attack. So that might be an example for that particular person. But, there's so many different pain pathways. That's a typically discogenic back pain. If the person had a facet joint, they don't behave that way. We do a lot of pattern recognition when we're listening to a person telling their story to help us begin the investigation of what causes their pain. Say they were crackbacked in American football and their spine was extended and they had a micro stress fracture in the facet joint or the pars bone that holds the facet joint on. That will be about 4 months of a low-grade pain with a little bit of a sharper, very local pain that they can put their thumb on. It doesn't get better within 3 or 4 days, but a disc could, depending on the posture. So you see how the mechanism also determines the character of.
I love your process. So you say you bring everybody in, you sit down, you talk to them for 45 minutes. It's just based on their symptoms and the history. you can usually pretty accurately identify, okay, this is what it sounds like. Is that usually how that works?
What we do after the 45-minute conversation, I'll follow up with a few questions that we know have a very high signal to noise ratio. I'm here to gather information, so I want the most information with the least effort.
Yep.
If they, let's say, yes, I get a pretty good hypothesis as to what their pain mechanism is. We do all that upstairs. Then we come down here. So sit on the stool, sit upright. Do you have pain? No. Slouch. Do you have pain? No. Stay there for 3 minutes. Oh yeah, my right toe is going numb. I'm getting a pain down my thigh. Good. Better or worse? Oh yeah, no, that made it worse. Or maybe they might say, oh no, that made it better. That was the underhooked nerve root that I was here. And then I might stand them up and do pelvic tilts. I might put them on the table and shear their spines and test activities, compression, shear, bending loads, and then I get into very specific tissues. For example, let's look at the pelvic ring, and the person says, well, I have sacroiliac joint pain. Most of the athletes who come here do not have sacroiliac joint pain. They have pain from the nerve that goes right beside the sacroiliac nerve, and it's actually, this is the mechanism, but it's referred to that location. But watch what happens. I will mechanically test the SI joints. I'm going to squeeze them around the iliac crest, watch the mechanic. Do you see that gets opened up and compressed, and the bottom gets distracted and opened up? Now I'm going to squeeze around the hip joints, the greater trochanters, watch the mechanics change, closes. And if one takes the pain away, the other increases the pain. In other words, if this one increases the pain.
So you're literally just going to palpate and push into somebody's hips?
As hard as I possibly can to try and move that pelvic ring. And if I create their pain, I know with precision the mechanic that just created it. Now I go back into their training program. That didn't just come out of thin air.
Right.
Where did that pain sensitivity come from? Oh, well, 6 months ago, I got a new coach, say they're a tennis player, and we've been doing heavy loaded squats. So I can race across the court, extend it.
Makes sense.
And look, you just, every time you do a split squat, this mutates this half of the pelvis anteriorly, this half of the pelvis is forward. You're doing that to the pelvic ring.
Right.
Now put 50 kilos on it, and now you increase.
Go fast.
So all of a sudden now we're finding the reason for that particular pain sensitivity or injury or whatever it is. Let's change the training. Let's figure out a more clever way. And by the way, why do you even need to do those split squats? Has anyone examined the demands of your sport? We spend a lot of time here examining the demands of the sport, and then we test the athlete for those demands specifically. If they don't need it in their sport or they're meeting the required demand, don't train it. We train the things that they need but don't have. So that's all part and parcel in this assessment session.
Yeah, so that's a really, you were talking about that before, the pursuit of strength, how what it takes to pull it out of your body. That was an interesting, really interesting conversation we had earlier today. I'd love to go there if you are open to sharing your insights.
Well, we were discussing about some of the very strong people that I've measured and worked with, 2 world record strength performances. And I was mentioning the podcast that I'd done with Bill Kazmaier, World's Strongest Man, and people like Ed Collin and Martin Licious, the current strongman champ, people like Blaine Sumner, who has, I believe, I don't know if he still has it, but the highest Wilks score, powerlifting score, and Blaine is, again, another fabulous athlete. And what we were talking about was what differentiates these people from pulling off world record performance. I think of Brian Carroll, who I worked with, and we wrote that book, Gift of Injury, together. And post-injury rehab, he got back and squatted the world record of 1,306 pounds. And I said to him, do you think you'll ever do it again? He says, no, I can't. That was the perfect lift. I've only ever had one perfect lift, and that was it, which was kind of interesting. But we talked about when you're in the room with someone who can do that, to even put, say, 12 or 1,300 pounds on your shoulders and stand there. Strength is a thought, and that thought has to be converted into pulse trains, which then go down the nerves to the muscles. They are so dense, and if you're aware, the hairs on your own neck stand up with that density of neural drive, as we would call it in a scientific sense. It just burns. It's incredible. To get, and one step back from that, well documented, a woman will see her child trapped under a car, perhaps. Well documented, she goes and picks up one end of the car. She avulses a bicep, she burst fractures a vertebra, but she picked up the car and her kid was extricated. So we all have this somehow ability to dampen out all the fuse boxes that are there to allow us to survive so we don't tear up our bodies. But the athletes who are able to achieve this somehow do. And this fascinates me. And the psychology of it, there's a mental state where you have to get to where you're willing to commit murder on your own body and be willing to tear it apart and hopefully your technique is good enough that you know how to survive that overriding of all of the safety systems. But the mindset to take your mind there, I talk about it as the dark side. You have to cross the line, and you know what I'm talking about, to go into that zone where they might do it with heavy metal music, banging their head against the wall, swearing, getting into a rage where it's so dark that they are able to convert that thought into the densest possible neural drive. And then you take the only exception that I've ever been able to find all of these strong performances is Bill Kazmaier. And I don't know if you know Bill. He's a lovely,
it's amazing,
wonderful, wonderful man. So kind. But he says it's the power of the Lord. It's the light. And when you're with him and he's getting primed, as I call it, he gets pimples, and then the speeds of sweat, and now he's ready to compete. But he says it's the light that invades my body, and that allows him to have the conversion. But Brian Carroll and Blaine and whatnot, if they can't reach on a particular day that murderous dark frame of mind, they're 200 pounds off there.
Do you think with Bill, did you ever ask him if it was always that way? Because I'd be curious. Let's say in the beginning, without question for me, it was just the darkness, and I craved the darkness. I was like, I want to go into that. I would seek it, but eventually, I learned how to create that level of intensity. I think very close to that level of intensity, without necessarily having to go there, because it became a skill. Whereas in the beginning, it felt like a trait. It almost became, or maybe in the beginning it was a state, and then it almost became a trait. So I'm curious if Bill had a transition.
Well, I can't speak for them as individuals, but my observation is they all have something in their experience, whether it's growing up and a personality trait, that they're able to go there. And it usually was something that happened to them that wasn't good. They might have been battling their father or an institution or something that had really happened. And they were able to go to this very dark place and create that. But I agree with you as well. It is a skill. And but you know what? I think of some of the combat athletes as well, who I have never met an unintelligent one, despite what people think. They're usually incredibly eloquent and deep thinking, and their darkness is slightly different in that they will say, I don't feel alive until I'm close to death. And they thank their opponent for taking them there, which is really weird.
I get it.
And that opponent could be a barbell as well, from a Polish strength background, which we can talk about that eventually if you like. But the respect of strength and all that bar is in terms of being an opponent is the epitome of Polish strength. You know, if you walk up to a platform in Poland and you move the bar a little bit with your foot, you will be shunned.
Yes. Don't step over the bar. Yeah.
You would never do that.
Yeah.
So the culture of respect, as that bar being an opponent, maybe is the surrogate for creating that honor. That bar is going to pull the greatness out of me.
Yeah, there's a lot to unpack there, because the character that's developed in the deepest depths of those hardest moments, in my opinion, is what, again, you could argue both directions. You could say either the person who's pursuing it had that to begin with, or that's what's developed as a result of going into your darkness, going into those deep moments and overcoming your fears and overcoming the excuses and overcoming everything that exists in your mind. It'd be an interesting exploration to discuss with these guys to reach that level. Like, what is that, right? What is that there? How do we get there? And which came first, right? And it, you could also argue that the people who pursue these types of things, it's their destiny. It's like, this is like, I know for myself, the challenges of my youth, I always say, like, I needed bodybuilding. I hope to goodness my children, everyone's like, hey, you want your kids to be a bodybuilder? Like, I hope to goodness they don't. Like, if they need it the way I needed it, I messed up as a parent. And so I wonder, it's an interesting psychological.
You already know them, I'm sure, but I could name a few athletes where that would be the most fabulous panel to listen to. They're all very honest men and women. I was curious in your comment of you said you screwed up as a parent. And one of the hardest things with me as a parent was to know when to be hard and when to be soft. And I didn't grow up with a lot of softness. Much more the opposite. It made you who you were. It made me who I was, although I never got close to the strength side of things that you did. But how much of that? Where's the balance with raising your own kids? Because you want them to have a little bit of hardness.
It's the perpetual dialogue in my head. And I, recently I was thinking about probably the reason biologically for having a mother and a father is exactly that. Like, I think the mother has to be this goddess of unconditional love and acceptance. And the father's meant to be like the driver of hunting. Like, you need to become a hunter. And
no, I'm going to recommend you for a podcast.
Yeah. Well, that's my belief. And the more you diverge from successful marriages, the more the children have the absence of that. They don't have the unconditional love of the mother. They don't have the constant, just like pushing to be better, pushing to like, here's the things you need to be as a dad. Because I don't do that with my kids. I'm much softer. I've grown to be much softer with them than I would want to be. Like, I want them to push. I want them to experience discomfort, and I want them to know they can turn around and I'm going to be right there at their side. But in order to do that, I need to know that they need to go home and have complete unconditional love and acceptance, and be able to relax in a peaceful, serene place to recover from that. Whereas if they don't have that, then I have to be both, and that's a really hard game to play as a dad.
You might find that changes as well. When my kids became adults, that whole game changed, and I've become much, much softer.
Yeah, totally. Yeah.
And I'm not a grandfather yet, but one of these days, I know I'll be a better grandfather than I was.
Well, it's less pressure, right? It's like, because you just want your kids to know this world can be an amazing gift, and it can be a huge challenge depending on which road you decide to take. And you just want them to take the right road, whatever the right road is for them, right? You want them to be, I want them to be equipped. And so exposing them to enough challenges and hardships where they become resilient. And so I always say, like, if nothing in your life is hard, then everything in your life is hard, right? Every step you're going to run into is like, that's just so hard for me. It's overwhelming because everything before was easy.
Yeah, that's very JP-like.
It just seems to make sense, doesn't it? Like,
I'm going to ask you a question.
Shoot, of course.
We know who you are and where you came from. And one of the challenges that I have is a very physically imposing athlete or their team will ask, can I assist with their back issues as they are returning to civilian life? And it is a very different consult than it was if we were on the building side to getting them there. What's the psychology like when people hear the name Ben Pakulski and they see the image, and in your own mind, you have to be that image? Now you're deciding, I'm going to return to a civilian life, which means detuning my body and letting go of all of that stuff that you had to build in with the most exceptional dedication. And people will recognize you because of the guy who was so visually impressive.
Yeah.
How do you, because very few have the strength of mind to do that.
Yeah, I feel like bodybuilding wasn't who I am, it's what I did. And I feel like I needed it to overcome deep pain, deep fear, inadequacy, like all of the emotions. And so for me, it was my battleground, it was my training ground. And to leave it, I still feel like my identity is in many ways still wrapped up in bodybuilding. To still, you still have some psychological unconscious pull to look a certain way. But as I said briefly prior to us recording, there's just a new purpose. And if a bodybuilder can take the level of focus and purpose and drive and find that new direction, the sky's the limit, right? As you say, like there's very few people in the world who can do what bodybuilders do as far as the level of discipline and focus. And so it's probably very hard for most athletes, any type of athlete, to find a new purpose that ignites them at the same level as that childhood one did. But if you can find it, that's really been my new direction. It's how I've been able to transition away and be completely comfortable with not having to be the biggest guy in the room anymore. There's still some egocentric drive when I walk into a room because I've always been the biggest, the fittest, the whatever, all the words, and to not get the attention anymore. I notice it, that whereas before it was like everyone's head looks. Now I'm like, I'm not getting it anymore. I'm like, am I okay with that? And I'm like, yeah, it doesn't have to be that anymore. So I accomplished everything I ever wanted to accomplish. I think that's another thing, is a lot of athletes don't get to do that. I did it very young, and there was nothing else left for me to do in that sport. Yes, I wanted to be Mr. Olympia, and my children were born, and I was like, I can't. I literally sat there and made a conscious decision to, and I said, do I want to continue to pursue this and know that I don't believe that I can be the parent I want to be? And I made a conscious decision. I said, there's no way. Like, there's no chance that I would pursue this, because I literally played it back in my mind. I'm like, what would it look like if I was standing on stage holding the sand out in my hand and saying, "Win the Mr. Olympia," and my kids say, "You're a terrible dad, you're never there." And I was like, no. Like, could I have done both? Maybe. My belief was I couldn't, just because I knew how I was in bodybuilding. I was the guy you said, I was ruthless. I was an animal. And I was like, I personally couldn't do both. And so that's why it was more than reasonable for me to say, I'm going to compete a little bit more. I'm going to lay it on the table. I'm going to do the best, I'll do everything I want to do, and then walk away. So I left on my terms. And I think as many athletes get injured, they get cut, they get whatever, they don't leave on their own terms. So if an athlete could preemptively say, here's my terms, and when I accomplish this, then I'm going to decide to go, I think it's easier at that point to let go of the need. Because as you know, most athletes, not most, but many, need what they do. They want to do it, but they also, it's some like deep drive, some pain, some, as we spoke about. So if we can let go on your own terms, for me, I'll speak for myself, because I was able to let go on my own terms, I was, completely at peace with it.
Good for you. That's
doesn't seem common, does it?
No, it's very uncommon. The people say, well, when does the psychological really take over in my line of work? And it's probably the heaviest in those situations.
Yeah.
Getting someone to let go and they don't have one more fight left in them or one more show to prepare.
And they just want so intertwined in their identity.
You're becoming wise.
So my son says about my gray beard. my wisdom. I'd love to hear more about this phenotypical kind of expression of strength that exists all around the world. You talked about that, and that's
Yeah,
a different touch.
I'm convinced. This is only my impression from working with different athletes, but I think there's a God-given strength gene in Finland, for example. And in a lot of Finns, they have a superhuman amount of strength and explosive power if they're taught how to unleash it. And that's just God-given.
Mm-hmm.
There's certain hip architectures that allow you to run really, really fast. If we look across Caucasian femoral head here, the highest rate of hip dysplasia in Caucasian Europe is Poland. I don't know if you knew this. So hip dysplasia is a very shallow hip socket, and the hip will dislocate like this. If you can get past the risk of hip dysplasia as a youngster, that shallow hip socket allows you to deep squat. Deep squatting with the knees together is what allows an Olympic lift. Where do the Olympic lifters come from? Bulgaria, Poland, Ukraine, Western Russia.
Yep.
And there's some of the Asian nations as well in the lighter weights. But it's interesting that if you don't have that shallow socket, you cannot be an Olympic lifter. If you don't have the gift of hip external rotation, you will never be an Olympic lifter. The polar opposite, by the way, and a little bit more on the athleticism. Not only does that shallow hip socket give a deep range of motion to allow the deep squat and not have stress concentrations in the lumbar spine, when you measure the power production, it's ungodly out of the hole. So the deep squat and the rise, big power production. Typically, the failure is at lockout. So once the weight gets a big power off the floor, when they get with that architecture, it's not favorable once they get the weight past the knees, and there tends to be a higher failure rate at lockout. The polar opposite of a shallow hip socket is, hip dysplasia is femoral acetabular impingement, which comes with a deep hip socket, so that the femoral neck collides with the hip socket. Now, the highest incidence of that is in the Celtic nations, Normandy, France, Scotland, Ireland, and you know what my name is. I'm hip replaced. Very high rate of hip replacement because of the damage to the labrum if you were to deep squat. And when you measure the power production out of the hole in the archetypical square Celtic deep hip, it's very poor off the floor. But once the weight passes the knee, they fail a lot.
Right.
Tremendous second gear, so to speak. So it's very interesting. I'm not saying every pole has a shallow hip.
Sure. What drives that power to the hole in that case? It's because it's not obviously just hip orientation that drives it. It's going to be some muscular orientation that's driving that power to the hole.
Well, that's true. But I don't know what the muscular differentiation is. It's just more if you're not impinging. As soon as you impinge the labrum, the pain will inhibit. So as soon as you get pain in your body, a Fusebach registers and something shuts down. So we've measured, for example, when we were able to create hip pain in patients, we measured the ratio of neural drive to the hamstrings and the gluteal muscles. Hip pain inhibits the gluteals and you become hamstring dominant. So as soon as you get impingement, you lose the ability to drive with the glutes. So I don't know if it's a muscular architecture. You know, you get pain and you limp.
Right.
Well, your body will limp in many ways depending on.
So one of those sound bites I brought up earlier about what's getting thrown around the internet is like the glutes are probably the most significant influence on spinal stability, lower back stability, pelvic control. And so that would make sense, right? Because if someone's hip is in some way inhibited or some way impinged and the glute turns off, and you could turn the glute back on, it may give you better mobility or better control through the hip, better force production through the hip.
Absolutely true. But there's another very interesting thing, and it goes straight back to plain old biomechanics. when you become hamstring dominant, so both the hamstrings and the gluteals, when a person is inhibited in the glutes because of the pain fuse box, the line of action of the hamstring jams the femoral head anteriorly into the labrum. In other words, it increases the jamming.
Right.
Whereas the gluteals, when they extend, they glide the femoral head back.
Right.
So if you can get more glutes, we were talking about Pavel earlier, some of his exercises of dropping down into the squat, wiggling side to side, more glute, and then you can go deeper into the squat, avoiding the impingement. So these are all techniques to become a little bit more gluteal dominant, but that's the architectural difference of those two muscles and how they actually impinge on the hip interface.
I spend probably 30% of my weekly workout time on glute training and glute activation. That sounds ridiculous coming from a man, but I know that if I can make my glutes work, my knees don't hurt, my back doesn't hurt, my hips feel great. And if I don't do enough of it, it deteriorates. So I'm like, I spend an inordinately large amount of time on like making sure the glutes can activate at all aspects of the range.
I hope people hear that, because can I give another little explanation of why that wisdom is so powerful?
Yeah.
When I extend, so I'm just going to do a little bit of a jumping or a lifting kind of a mechanism.
Yep.
Assume I have an artificial knee with no muscle. I could still lift, and you couldn't tell the difference by looking at the kinematics in motion. Can you imagine if I had a motor here and I could turn that? Do you see how my gluteals are extending my knee?
Yeah.
Do you see how my gluteals are plantar flexing my ankle?
Yeah.
So because we live in this articulated linkage, the gluteal power is able to radiate out joint by joint by joint, having an effect as long as the end is locked into something. Closed chain, foot's locked in on the ground. So you definitely do. I've measured this. When you become gluteal dominant, you unload your knee.
Talk to me about what's happening in the pelvis around back injuries, because we often hear, the diaphragm's controlled. Obviously, diaphragm has a significant impact on the rib cage and the intercostal muscles and how that wraps around, attaches on the spine, and then we get into the pelvic floor. And if the diaphragm is dysfunctional, the pelvic floor can also become, quote unquote, dysfunctional. I'm curious what your research and exploration has discovered around those two specific aspects and how they're playing into back pain. It's a pretty broad question.
Well, yes, no. I think when you look at the science on the pelvic floor, it's almost always measured in either a zero load or a low load environment. They're not looking at athletes like you and their pelvic floor. And pardon the expression, but have you ever tried to squat while at the same time sucking your balls up?
Only if I'm teaching somebody that.
Okay. It's terribly inhibited.
Oh, you can't do it.
In fact, you do the opposite.
Right.
Strong women do as well.
Push out.
You have to push out, because what you're trying to create is stone.
Right.
If we look at the architecture of something simple like pec major, uniarticular muscle, spans the shoulder joint, origin on the rib cage, insertion on the arm. If I push you with pec major, so say I'm going to really work on bench press, get some pec major strength, then I stand and I push you. Distal to the shoulder, the ball and socket joint, it creates the desired effect, the push. But look what it does on the proximal side. It collapses me.
Mm-hmm.
That muscle collapses me in the push of an opponent or a door or whatever it happens to be. So that muscle is actually neutral on its own for creating the end effect. But as soon as I lock down my pelvis, I lock into the ground, 100% of that muscle activity just went to driving my arm now.
Right.
Arrested the athleticism that wasn't helping. So proximal stiffness unleashed distal athleticism.
Right.
Yeah. So it's the same with the hips and the pelvic floor and the diaphragm as a unit. Can you imagine a world-class sprinter where if they didn't lock down the core, when the glutes exploded, they would cause this bending of the spine. It's an energy leak. Arrest the proximal motion and drive it to the distal side of the joint, and you will get a faster thigh extension and faster sprint speed. So I can go through example after example of this. You're trying to create pulse strength, and in that ball and socket joints create pulse strength, but they're linked by a fairly stiff core. So when you look at striking in combat sports or throws or whatever, the more stone-like you can make this, the more athleticism there is either side of the joint.
And so that brings up what you spoke about earlier, training abdominals with isometric, exercises that are creating rigidity, the ability to not move, then transfer force to the limbs. Makes a lot of sense.
It's how the strongest men and women in the world train. This is more isometric. These are obviously more dynamic.
Yeah. So I'm curious how the orientation of the rib cage relative to the pelvis plays into that, and how much we can actually affect it. So, I have some people who are hyperlordotics, rib cage flare. Some people are super rigid to the thoracic spine, often the same person. I'm curious, is it a requirement in your experience to get maximum output through the spinal muscles to have the rib cage oriented over the pelvis in what we'll call like a stacked alignment? Or you may have a different term.
Well, for strength, I would say yes.
Yeah.
But if you're a swimmer, I would say no.
Huh.
So if I didn't have thoracic extension mobility,
Right.
and I was a freestyle swimmer,
Yeah.
my power production would be here, and I couldn't reach right for the. Do you see?
Sure. Yeah, you want to be able to extend. How for sprint?
Sprinters have a lot of lordosis. You cannot sprint with a flat back. Well, that sounds absolute. The best sprinters in the world have more lordosis. So the reason for that is if I'm sprinting, the footfall has to occur behind my center of mass. So you've got to have footfall behind the center of mass. And then the power transfer to the ground has to go through the extensor range. It's a great advantage to turn my pelvis with lordosis because I have more extensor power.
Right.
But I won't be able to kick high in martial arts. So you'll notice a lot of the fighters have a flat spine. And if you've ever watched them sprint, it's not a pretty sight.
So interesting how so do you think it would be possible, I'm sure the answer is yes, but the likelihood of someone being effective at both of those, like, is it the circumstance where one is going to cannibalize the other? Like if I want to be really good at martial arts and I default to a posterior pelvic tilt so I kick somebody in the head, does that take away from my sprint ability because of where I'm positionally strong?
Yes.
Yeah.
Yeah. That's why when you, it's always fun to watch the Olympics and the podium medal presentations. The three hammer throwers basically look the same.
Yeah.
The three swimmers basically look the same. Shorter bodies.
Yeah.
Bigger feet. So at that level where you need every advantage to be the best in the world and win a gold medal, and if you're second and third, the physical variables that contributed to that performance have to be optimized. And it's why we all look different by sport.
Yeah. I think that's so fascinating. Something that's coming up for me as we're talking about this is the pelvis's influence, or the orientation of the pelvis and that's influence on spinal positioning and ultimately injury. So we see, hip hike, we see rotation. How much have you explored that's influence as far as it's translating to any number of spinal injuries?
You're going to have to give me a specific example.
Well, so if I see somebody walking into my gym and they're saying, hey, I notice a very obvious hip discrepancy. And so my natural instinct is like, what can I do with this person? What can I not do with this person? Maybe there's no expression of back pain yet. It looks to me like there's a loaded gun here. I'm like, should I be playing with fire? Even though I can see a very, obviously relative how big the discrepancy is. So I'm curious, if you've seen like, hey, if this expression of hip orientation is very likely to lead to that spinal injury.
I understand your question now. I would have two answers, and they're really quite different. I remember a number of years ago, I was consulting with an NBA basketball team, and the team doctor and myself were there at the training camp before the season started, and we were watching the players play and just talking as we do amongst ourselves. Oh, I think so-and-so, we have to watch that knee. I think that's going to become injured. And someone else would say some other injury. And I said, okay, well, that's interesting. Let's lay a bet. So we both wrote down on a piece of paper who we thought would get injured that season and what injury it was going to be. And we agreed that we would seal it up in an envelope, put it in his desk, and pull it out after the season. We were right for 3 out of 5, I think it was. So that suggests that what our eyes saw was exactly what you're seeing. People come into the gym. We've also tracked athletic groups and occupational groups doing exactly this. We would follow them. We took the Toronto Police Force ETF, the Emergency Task Force. There were about 70 men, all men, and very steady employment. No one quit over those 5 years. And we followed. We did health profiles before we started. Their movement competency on squat, lunge, lifting things, and that sort of thing. And we also tracked a little bit how they trained. Are they in the weight room doing 10 burpees, 10 Olympic lifts, and something else, or however it was they were training? Over those 5 years, we tracked the musculoskeletal injuries, and in particular, the back injuries. We've seen in certain sports as well that there are predispositions. I read an article just the other day. We had said for years that the flatter your back, and we measured this experimentally, by the way. We screened something like 250 students at the university, and we measured the most lordotic ones and the most kyphotic ones, the flatter backs. The ones who had flat backs actually stood with less stress, but when they sat down, they had more stress versus the ones who had a lordotic spine. They stood in the elastic extensor stress, but when they sat down, they had less stress.
Interesting.
It was, yeah. And then we gave each group's corrective exercises to see if we could de-stress their spine. And in fact, with the hyperlordotic ones, we did. So that was an issue.
So what exercise would you have prescribed for someone who's hyperlordotic?
It was a Czechoslovakian urologist. He had a program where he said, if you're hyperlordotic, you have tight hip flexors, tight being his word, or short, and then you needed more gluteal horsepower. The flat backs, you would, they had tight abdominals and weak backs. So you would stretch what is tight, strengthen what is weak, according to the Yonda program. And that was the first proof that it worked. So we trialed them, and we actually were able to change their elastic equilibrium when they were standing.
So that's a phenomenal intervention, though, because, we'll often hear people speak about the minimal ability to change somebody's posture, the resting posture. But if you guys actually did it with some really simple interventions, because I hear all the time people like, you can't help somebody. Obviously you can hypertrophy somebody's muscle, you can change the relative length tension relationship, but you're not going to make a drastic change to someone's resting posture because there's so many factors, right? People are like, well, there's lifestyle factors, there's stress factors, there's so many intervention or potential factors.
Right. That was published in Physical Therapy. It was the most downloaded journal. It's interesting with corrective exercise. We've done quite a number of trials over the years. One I remember on hip mobility. And we took, who has the stiffest hips in Canada? The hockey players. They're somewhere around the 5th percentile on range of motion typically. But one of my PhD students was an outstanding clinician in training hip mobility. And she trained in these very stiff hockey players, 5% in the population spectrum now, 5th percentile. She stretched muscles, nerves, fascia, joint capsules, really good 3-dimensional stretching of the hips. She moved those hockey players from a 5th percentile up to something incredible, like a 70th percentile.
Wow.
So yet again, she proved that the corrective exercise could make a physical difference. But here's what we learned, and we learned this in other studies as well. Do you think it changed their movement?
No. And I was going to say, did it increase the likelihood of injury? That would be my question. Or did
you're right on. Yeah. You're absolutely right on. So, I know sometimes I would go to my kids' sports and I'd forget my eyeglasses, or I couldn't see the numbers on their shirts, but I knew who every player was by their movement.
Sure.
Exactly. So everybody has a movement signature. You can change the range of motion of some of their joints. Do you think you changed their movement signature? And the answer was no, we didn't. So now we get into the argument, is movement a physical state, or is it what the neuroscientists call an engram? An engram is the tape that's in your, so walking is in your spinal cord. More complex engrams live in your motor cortex. And we see this with injury. We talked about this. Pain and injury corrupts your engram.
Yep.
Even when you're healed, once again, you're still operating and moving with a limp, or for a back, for example, we have to retrain the movement. And that's the key. The hip mobilization study, even though we gave them the ability to move their hips and they didn't, it's because we now have to overwrite their current engram with the new one. And that's what a lot of trainers don't get.
So it would have to become a period of conscious incompetence, and like I need to move toward unconscious competence, right? We're like
so if you're an athlete learning a new movement skill, whether you're a soccer player or whatever, you practice it over and over in quite a robotic way. So think of martial arts. You do the movement slow, and then you speed up the engram until you get to competitive speed. But you do it over and over and over again, you're writing that engram.
Yeah.
We also know that if you add load, you strengthen the representation. And load creates a stronger engram. Visualization. You rehearse the movement in your brain. You strengthen the engram. So your neuroscience has taught us a lot about this. If you can strengthen the engram and then repeat it enough so it becomes automatic, it becomes the new default movement pattern. So say we have a patient here and their first movement is just to collapse their spine and move, and yet they've got a disc bulge. So they will remain in pain until they remove that stress concentration. So we will go over with them how to move in a spine hygiene way, leave their hips, drop, step, turn, pull, flex, step, move well. 2:00 in the morning, the baby's crying. They get up and pull the child out of the crib. They don't have the new default software going yet. I blow up their disc and they're right back to a symptomatic patient again. All the training was for naught.
Yeah.
So the key is to, yes, become a robot, and then flow. We call it a flow state. Flow into a new default movement pattern. So I think we've proven the various layers of this, and reprogramming movement is the hardware. Changing the movement is hardware and software.
It requires such a level of presence, right? I need to be conscious and present in everything that I do. And so few people are able to do that in any aspect of life, certainly as much as is necessary to change a postural position.
I know I've had some patients where I've shown them the stress concentrations from a certain move, and it fires off acute attack after acute attack. And, they come in, I've got chronic back pain. No, you don't. You have repeated mini acute insults to your spine all day long because you keep picking the scab. If you stop picking the scab, the chronicity goes away. You don't have chronic back pain.
Right.
You just keep doing the same thing acutely over and over again. I've had some patients who've never had another acute episode. Immediately, they had that mental ability to personality. And then other people It's so frustrating.
Yeah.
I get a phone call. I've blown my back up again. Oh, what were you doing? Oh, I did this. And I said, well, you know what the pattern is. Yes, I know.
It's a personality type, right? We experience this in coaching is like certain personalities, you can give them anything and they're like, I got it. And certain ones, like you can coach them in any way and they just won't get it. Like, all right, I guess we're gonna do it. I'm not holding your hand, like, but yeah.
And you see this all through life. I don't know why this popped into my mind, but it did. I remember being a young teenager and I was stealing my mother's cigarettes, and she didn't yell at me. She stopped smoking that day. That is it. Now, a lot of people couldn't do that,
Right?
but she just had the personality that
Type. Yeah.
like that. So, we see it all through life. It comes right back to the essence of bodybuilding and the discipline that people have to, you decide to do it. It's non-negotiable.
You just do it.
It's done.
Yeah. Talked a lot, covered a lot of cool things on back pain. I think we've just basically started to scratch the surface. Is there anything else that we should cover today so the audience leaves with something? I just want to make sure we don't miss anything that's super important to you to share.
Not really, I don't think, from a back perspective. Again, as I said earlier, I'm just fascinated when highly successful athletes can make that decision and walk away. Muhammad Ali couldn't do it. And as much as, he's an absolute hero of mine, life would have been different for him. And you did it. A few others have done it. I think of GSP.
Yeah. Dorian Yates is a good example.
Yeah. For sure. He seems to be.
He's fantastic. We spent a month with him in Spain this year. And phenomenal,
yeah. Oh, good for you. Yeah. And then we see other guys who are just a tragic story.
Yeah. I think it's just an identity thing. There's nothing. I speak to some of the guys currently and like, what else would I do? I'm like, and I understand the fear. Like it's funny to see some of the old guys who were like the early 90s, late 90s bodybuilders still lingering around local bodybuilding shows because like that's where they're important. That's where they get their praise. That's where they get their accolades. And I'm like, dude, don't you have something else to do? Like, I just like lingering around, like going to the after parties. And like I feel I feel sorry for them many times. These guys that are still on stage and they don't want to be there, but they have to be there. And that, like, so when people are like, hey, you're still going back to the shows? I'm like, man, I have so much respect for everyone in that sport. But no, like, I'm not. I don't have any reason to go. Yeah, and it's not any resentment. It's not any, like, I'm saying, it's not any reason. And these guys don't have any reason to do anything else, which is interesting, I hope they find it. I hope they are happy. And, yeah. And it's probably just funny because that's one of the questions I get asked maybe most I get a lot of athletes that contact me and say, how did you change? How did you transition? For me, it's just like, I put a lot of time and effort into, I think it's also, I had a lot of internal inadequacy stories around my level of education, my understanding of all of it. And I was like, well, I want to be good at this. So like I did the physical part and like, now I want to do the mental part and I just pursue that now. And like, if I could curate my life in a way that because that's the new goal. So the goal is really two-pronged. It's like, I want to have the family that I didn't have. I want to have an education that nobody ever helped me with. So then it's like pursue that, the same amount of focus.
I love hanging around great people.
Likewise. Absolutely pleasure.
Thanks, Ben.
All right, that's a wrap, ladies and gentlemen. Thank you very much for being here and giving us your time, attention, and ultimately, we are here to support you in understanding how to build a body that you absolutely love and that supports life as an adventure. Dr. McGill, as you hear, is just a wealth of information, breaking a lot of paradigms in the process, which I love hearing people who ultimately have done it at the highest level, right? There's research, there's application, and then there's the integration of research and application. Dr. McGill is certainly someone who is at the cutting edge of the integration of research and application, which I just love and respect so much. This gentleman has worked on over 245 peer-reviewed scientific papers, several textbooks, and many international award-winning awards, including the Order of Canada in 2022 for leadership in back pain. Dr. McGill, you're a gentleman. I truly appreciate you, your life's work, and I look forward to doing it again. To our listeners, thank you for being part of the Muscle Intelligence community. For someone who ultimately wants to live your greatest life and support the community around you, I often talk about, like, you're going to become the people you surround yourself with. Let's all lift each other up, share this incredible information with someone you know and love, would benefit from it, and ultimately someone who has back pain or someone who just benefit from the understanding of a depth of knowledge when it comes to preventing long-term back pain. And thanks once again to our sponsors, Bioptimizers. Head over to their site to get hooked up with 10% off their entire line, which is something that's just a staple in my medicine cabinet consistently. The things that I'm religious on is Mastimes and Mag Breakthrough are just always there. Even if I travel, people say, what's the minimum I should be taking when I travel or when I'm on the road? Those are two things that are non-negotiable for me. And if I were to pick only two things, it's probably only those two things, magnesium and digestive enzymes. Both I just love, especially as a man getting a little bit older. I have to watch my digestion, watch my stress. Those are probably the two biggest things, certainly for me right now, making sure my performance stays and my recovery is on point. Ladies and gents, thanks for being here. Have a great day. Talk to you soon.
Thank you so much for tuning into Muscle Intelligence. If you enjoyed today's episode, please be sure to share it with at least one person you know. Make sure you're subscribed so you never miss an episode. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Ben Pakulski and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.